Well, thank you very much, Alicia. Good morning. I'm Bruce Vanderhoff, the Director of the Ohio Department of Health. Thank you all for joining us here this morning. Today, the Ohio Lottery Commission Director, Pat McDonald, and I will share an update with you on the upcoming Ohio Vax-2-School program. We continue to be at a crucial point in the pandemic. Right now, our 21-day case average is 6,535 cases reported daily. We're also averaging 257 Ohioans with COVID-19 who are admitted to a hospital every day. A year ago, at this time, we were averaging around 1,000 cases per day with 68 daily hospitalizations. As you can see, from 1 year ago to today, even though about half of us are well protected by vaccination, our daily hospitalizations are more than triple what they were averaging this time last year. And the reason is simple. The Delta variant is aggressively seeking out anyone who lacks immunity and is making them very sick. For those who have not yet been vaccinated, there really is no better time than the present. And for parents of adolescents ages 12 to 17, now is an ideal time to talk to your pediatrician or pharmacist or other trusted healthcare provider to get the facts about COVID-19 vaccines. More than 370,000 Ohioans in this age bracket, 12 to 17, about 42% of the Ohioans in that age group have already started the vaccination process. And nationally, almost 13 million people ages 12 to 17 have started their vaccination. In addition to the millions of 12 to 17-year-olds who've been vaccinated, we're hearing promising news following the clinical trial and safety data submission to the FDA by Pfizer for their COVID-19 vaccine for the 5 to 11-year-old age group. Top-line data for the vaccine, which was administered in a smaller 10 milligram dose. Now that compares to the 30 milligram dose that's used for people 12 and older. That top-line data showed the vaccine was safe and generated robust antibody responses in that 5 to 11 age bracket. Pfizer has said their formal EUA submission is anticipated in the coming weeks. And FDA officials have said that once the vaccine data has been submitted and all necessary things are in place, the agency would look towards authorizing a vaccine for younger children in a matter of weeks, depending upon the timing and the quality of the data provided. Now, in addition, in anticipation of a COVID-19 vaccine being authorized for children in this age bracket in the near future, we've decided to broaden the Ohio Vax-2-School program to include this age group should they become eligible for vaccines. Today, we're announcing that Ohio Vax-2-School will double the prizes from the $1 million announced by Governor DeWine to $2 million in total prizes. This will include 150 $10,000 Ohio 529 College Advantage Plan scholarships and 5 $100,000 grand prize scholarships. And rather than being limited to Ohioans 12 to 25, pending FDA authorization, the program will expand to ages 5 to 25. It's important to include all of these age groups if possible. Right now, about 46% of Ohioans in the 12 to 25 age bracket have started the vaccination process. But by comparison, 84% of those 65 and older have started the process. Now, this is the time for younger Ohioans to get the facts and to make the choice to get the COVID-19 vaccine to help protect themselves and others. And we're hopeful that the $2 million in scholarship prizes will provide an incentive, much like Vax-A-Million did, to help speed up the timeline for Ohioans who are seeking to be vaccinated. As you'll recall, in the first week after Ohio Vax-A-Million was announced, there was a 44% increase compared to the base in vaccination rates for those 16 and older, and a 15% boost the following week. For all ages, there was a 106% increase compared to the base in the first week, and a 53% increase in the second week. The 155 winners of Vax-2-School will be able to use their scholarships for education at an Ohio college, university, technical or trade school, or career program of their choice. Starting Monday, Ohioans can enter at ohiovax2school.com. That's ohiovax, the number 2, school, all one word, .com. However, you're encouraged to only enter yourself or your child once you've received your first dose of the COVID-19 vaccine. So if you or your child has already been vaccinated, you can enter starting Monday. And if you were vaccinated months ago and entered Vax-A-Million, you're still eligible to enter. However, your Vax-A-Million entry doesn't carry over. You must enter on the new website for Ohio Vax-2-School. One quick item of note, this is an opt-in program. So if you've been vaccinated and want to enter, you must plan to do so at ohiovax2school.com beginning Monday. You can also enter by phone at 1-833-4-ASK-ODH. And you can do that between 9 a.m. and 8 p.m. daily. The odds of winning are going to be the same whether you enter by phone or online. Now, we are not yet announcing a deadline to enter or specific dates when winners will be announced, but we will share those details moving forward as we learn more about the EUA for the Pfizer vaccine for those ages 5 to 11. We want to keep the window of opportunity open as long as possible for this age group in hopes that they will soon be eligible for the COVID-19 vaccines, as well as Ohio Vax-2-School. Just like with Ohio Vax-A-Million, the Ohio Department of Health is using a portion of its coronavirus relief funds to fund this innovative public outreach campaign. If 5 to 11-year-olds are authorized, the deadline to enter will follow approximately 2 weeks later, with the winner announced to follow, all the winner announcements to follow. Now, I want to turn to Director McDonald for a little bit more on the actual logistics of the drawings. Director?
Well, good afternoon. Thank you, Dr. Vanderhoff. The Ohio Lottery is excited to assist the Department of Health and the governor with the Ohio Vax-2-School incentive. As with the highly successful Vax-A-Million, our role is to conduct the drawings and share the results with the Department of Health. Beginning Monday, October 4th, as you mentioned, Ohioans in the eligible age group who have received at least the first dose of the COVID-19 vaccine can visit ohiovax2school.com to enter to win one $150 $10,000 scholarship or one of 5 $100,000 scholarships. Entry is quick and easy. There are 2 sections for registration, one on the website, one for minors and another one for age groups of 18 to 25. Children under 17 must be registered by a parent or guardian. Parents would like to enter the children should fill out the form for the 12 to 17-year-olds. If a vaccine for 5 to 11-year-olds, as you mentioned, is authorized, the website will update accordingly at that time. Simply go to ohiovax2school.com, click you or your child's age group and register. You can also register by phone at 1-8334-ASK-ODH between 9 a.m. and 8 p.m. daily. As Dr. Vanderhoff mentioned earlier, the Department of Health is encouraging people to only enter once they have received their first dose of the vaccine. At a future date to be announced by the Department of Health, we will hold the drawings. Just like with the Vax-1,000,000, the drawings will be conducted using a random number generator. A random number generator is a computer which will assign all entries with a number, then randomly select the winners from the pool of numbers. This process will be overseen by lottery draw security personnel and observed by the director of our audit department. It is important to note that even if you entered Ohio Vax-1,000,000, you still need to enter again for Ohio Vax-2-School. We're excited to once again do our part to assist the Department of Health. I hope you will help us spread the word about Ohio Vax-2-School and encourage younger Ohioans to get vaccinated. Now I'm going to send this back to you, Dr. Vanderhoff, for closing remarks.
Very good. Thank you, Director McDonald. Well, as you know, COVID-19 vaccines are really the way that we will ultimately gain control of this pandemic. As we continue to experience high numbers of cases and hospitalizations, particularly among younger Ohioans, now really is the time to be vaccinated. So if you need more information about the vaccine, talk to your doctor or other trusted healthcare provider. Get the facts. And once you've been vaccinated, know that you can enter for Vax-2-School at ohiovax2school.com starting on Monday. Now, much like the Ohio Vax-1,000,000 program, the Ohio Department of Health will verify the vaccination status of those whose names are drawn. Before we move on to questions, I want to share, though, I think a nice update regarding our COVID dashboard with you. Later today, we'll be launching a variant dashboard at coronavirus.ohio.gov. You know, over the past months, I've shared information with you regarding COVID variants and their proportions at any given time in Ohio. Now, this information will be readily accessible through our new variant dashboard, which will show the proportionality of variants over time, broken down into 2-week periods. I think it will be a nice addition to our COVID-19 dashboards. And with that, we can now take questions. Alicia?
Great. Thank you so much, Dr. Vanderhoff. And just a reminder for those who may have joined late, the topic today is Ohio Vax-2-School. So because we have both Director McDonald and Dr. Vanderhoff with us today, it's important to keep questions focused on the subject matter at hand. That said, our first question comes from Josh Rutenberg with Spectrum News. Good morning, Josh.
Good morning, Alicia, and good morning, Dr. and Director McDonald. Dr. Vanderhoff, my question is for you. You cited the success that you and the state felt that the state had as far as the number of vaccinations that rose as a result of Vax-1,000,000. This time around, why do you and the governor or whoever else decided to put this program into place? Why did you guys feel that this was the best course of action moving forward to increase vaccines in Ohio?
Well, I'll tell you, I think one of the things that is really important is for people who are eligible to be vaccinated to choose that protection as quickly as is possible, provided the vaccine's available to their age bracket. We really want people to be encouraged to make that decision sooner rather than later. And it's been very clear, not only from the Vax-1,000,000 program, but for a wide variety of incentive programs, that they really are helpful in getting people to move from that contemplative stage or being on the fence to making the decision that, yeah, I think I'm going to go ahead now. And we see the public health benefit of those vaccinations. It's very clear that what we have tragically been looking at in our hospitals, and it includes our pediatric hospitals, has been too many preventable hospitalizations and deaths. And so we're very eager to do whatever we reasonably can to encourage people to make that very important decision to protect themselves, to protect their loved ones, and to protect those that they interact with regularly from COVID-19 through vaccination.
Thank you, Dr. Vanderhoff. Our next question comes from Todd Dykes with WLWT in Cincinnati.
Hi, Dr. Vanderhoff. Thanks for taking my question. Being near Northern Kentucky, obviously we straddle the river and cover both sides. Did Kentucky's scholarship Vax program influence the decision to go this route? Or, just talk in general about, did you look at other states, especially Kentucky, to see how that worked relative to what's happening in Ohio?
Well, I'll tell you, that which most influenced our decision has been experience right here in Ohio, whether it was the success of Vax-A-Million or the success of many local incentive programs that have been underway here in the state. And I think that was then just reinforced or supplemented by success that has been witnessed in other parts of the country with these incentive programs for vaccination. But fundamentally, what we have seen is the benefit here in Ohio, and I think that was our primary motivation.
Thank you, Dr. Vanderhoff. Our next question is from Jim Province with The Blade.
Hi, Dr. Vanderhoff. Can you give us an idea of how long we're going to be willing to wait for FDA action on 5 and 11-year-olds, 5 to 11-year-olds, before we move forward with the drawings? And do you have any concerns about maintaining public excitement about this lottery with the uncertainty of the dates?
Well, of course, we aren't certain about the dates. And while that means that today we can't share specific dates, we anticipate that we'll draw our winners no later than the end of the calendar year. The process, though, of FDA and followed by ACIP/CDC approval for vaccines, previously with other age brackets has moved pretty expeditiously once the top line data had been submitted. That's happened now. We are, of course, still waiting for the formal application to drop for this age bracket from the folks at Pfizer, but there's no reason to expect that will be substantially delayed. And so I really am anticipating that this will happen in the not too distant future. And this is an important group of Ohioans, important age bracket for us to include in this effort. And it seemed, given how close it appears we likely are to 5 to 11-year-olds having the opportunity to be vaccinated, it really seemed prudent and right to give them a chance to participate.
Our next question is from Alan Henry with NBC4 Columbus.
Good morning, Dr. Vanderhoff. Obviously, schools have been in session for a little bit more than a month now in most cases. We were wondering, are you considering revising any of the quarantine guidelines for students? There's some districts telling us that they've had some kids out of school despite testing negative for the virus.
Well, I think that the question around quarantine is a very, very good one. And, I think one of the things we have to remind ourselves is, why do we quarantine people? And really, quarantine is designed to limit the spread of an infectious disease that can be highly contagious even among people who might not at the time have symptoms, and is a disease that can cause considerable suffering, illness, death within an infected population. And COVID-19 certainly still fits that bill right now. I mean, look at our hospitalizations, look at our deaths. Nevertheless, it is a legitimate question for us to be asking. When will quarantine or our current process for case investigation need to change or no longer be warranted in the construct that we currently have? And the answer, I think, is that the virus itself, as it is changing, is going to point us in the right direction. As our population's immunity continues to improve, and it clearly is improving, this virus will become less of a threat, which will allow us to move in a different direction in terms of how we think about quarantine and contact tracing. So we're very actively looking at all of that, as are state health officials all across the country. And I can assure you that not only is the Ohio Department of Health and the epidemiologic team at Health very carefully examining this question in partnership with local health departments, but this is being done in concert with state health offices all across the country. So we're very cognizant of the importance of keeping those processes in sync with the evolving nature of the COVID-19 pandemic.
Thank you, Dr. Vanderhoff. Our next question is from Tom Gallick with Gongwer.
Hi, Dr. Vanderhoff. I wonder, after the experience with Vax-A-Million and now this new program, if you see sweepstakes, other incentive programs as being a good use for other public health efforts, or does this only make sense in the case of, say, a pandemic?
Well, I do think that the COVID-19 pandemic is a very unique situation, and it is certainly an historic situation. It's hard for me to extrapolate from where I am right now much beyond thinking about how these incentive programs really are applicable and have shown benefit in the context of COVID to thinking about other public health situations. One thing I think I can say is that when we're looking at improving health, when we're looking at public health, it's always a combination of education, of support, and of encouragement. And I think that for COVID-19 and the pandemic where we are now, given the importance of vaccination, this is an important component to helping us move past the pandemic.
Our next question is from Laura Hancock with Cleveland.com.
Dr. Vanderhoff, if you already announced this, I apologize. I might have missed it, but do you have the actual number of people who would be eligible in Ohio? I know you gave vaccine rates from that age group, but how many millions of people will this be? Also, we're looking at coronavirus trends, and maybe we've already reached our peak with Delta. And I was wondering if you could comment on that as well.
So the first question, I do not have at my fingertips, and either our staff can work to get you that number, or I don't know, Director McDonald, if by chance you might have that number at your fingertips.
We don't have that number.
Okay. So good question. I don't have that, but I'm sure our staff can help you with that. Yeah. So as we think about where are we right now, and what does that mean for us? I think you're correct. Looking at the numbers in Ohio, I do think in most parts of the state, we are showing evidence of cresting. That's encouraging, but certainly not a reason for us to declare victory over COVID and walk away. There's still a lot of cases that we're seeing every day. And I will not feel confident that this wave is declining and passing until we start seeing some more definite and consistent decreases, particularly in our hospitalizations across the state. So cautiously optimistic about that, but let's bear in mind, this is not the first wave of COVID-19 we have faced. And this wave, the Delta wave, when it has hit portions of the world that have had low or negligible vaccine rates, has caused a level of devastation that we were spared here in Ohio. And why were we spared? Well, looking at our hospitals and our hospital numbers gives us the answer. As I've said over and over and over again, this has been a pandemic wave of the unvaccinated. It has been the rare instance where we have had a vaccinated person in the hospital, and even rarer for a vaccinated person without other immune issues who ended up in the intensive care unit. So what that tells us is our work is not done. Vaccination is still important, and it is our best key, our best personal and collective protection against being victimized by a subsequent wave of COVID-19.
Dr. Vanderhoff, our next question is from Dan DeRose with WOIO.
Well, good morning, Dr. Vanderhoff.
Good morning.
From the beginning, the sell was that COVID isn't impacting children as hard or as much. So does that make this a hard sell? When parents heard that narrative from the beginning, while that has changed a bit with Delta, do you anticipate this being a hard sell?
Well, I'll tell you, it's important for us to get the facts out in front of people. And it's important for people to understand that this is a dynamic virus. This is a virus that has been evolving over time. All throughout the pandemic, our effort has been to share the facts. It has been to make people aware of what we actually know is happening at the time and what we actually know at the time about the virus. And it is absolutely true that if we circle back even to our last winter surge, we were seeing this virus having a predominantly serious effect on older populations. But two things have really changed about all that. First of all, our older population now is, as I shared with some of the numbers that we have in some of those age groups, are well over 80% vaccinated. They're highly vaccinated, and they have been very well protected from this virus in terms of serious outcomes as a result of that vaccination. But in addition, Delta changed the game. The Delta variant of COVID-19 has had a much more significant impact on younger populations, landing too many younger Ohioans in the hospital, or sadly, in some cases, resulting in their deaths. And as we move towards having vaccination available, not only for those 12 and older, but in the very near future, 5 and older, truly, we land then in a situation where what we're looking at is a vaccine preventable illness. And any pediatric death, any pediatric hospitalization becomes even more of a tragedy, because as a doctor, as a nurse, as a healthcare provider caring for that sick child, you know that this was a vaccine preventable hospitalization, or sadly, in rare circumstances, death. So that's why I think most of us in the medical community feel that it is such an important message for parents to receive, that no, this being young is not an automatic ticket out from the devastating impacts of COVID-19. Vaccination, however, is your ticket for outstanding protection.
Thank you. Our next question comes from Andy